Hey everyone, welcome to Womb and Wellness, where we dive deep into health topics that affect our community. Today, I'm talking about something near and dear to my heart, cervical stenosis. Why? Because it's the reason all of my children were delivered via C-section. This condition often goes undiagnosed, and many women have never heard of it. I know I hadn't. But today we'll break down what it is, why it's overlooked, and why Black women may be at higher risk. Stay tuned. Let's start with the basics. Cervical stenosis is when the cervix becomes too narrow or completely closed. This can cause issues with menstruation, fertility, and childbirth. Many don't even know they have it until they face complications. Now, can you be born with it? Absolutely. Some people have a narrow cervix from birth, known as congenital cervical stenosis. This can happen due to Müllerian anomalies, which are issues with reproductive development, genetics, hormonal exposure in the womb, and connective tissue disorders like Ehlers-Danlos syndrome. So, how do you know if you have cervical stenosis? Look for these signs. No periods, also known as primary amenorrhea, severe menstrual cramps due to blocked flow, infertility, or trouble conceiving, and recurring infections from trapped fluids. Doctors typically use ultrasounds, MRIs, or HSG tests to diagnose it. Now, why are Black women more at risk? There are a few reasons. Black women tend to have higher rates of fibroids, which can lead to scarring. Chronic infections like PID also increase the risk, and healthcare disparities often lead to delayed diagnoses and limited access to care. Moreover, more cervical procedures like LEEP and cone biopsies can cause scarring. And yes, genetic differences may play a part too. When it comes to maternal health, cervical stenosis can be a big deal. It can cause implantation problems leading to infertility or pregnancy loss, complications during labor making vaginal birth difficult or impossible, higher risks of preterm labor and fetal distress, and more C-sections, something Black women already experience at higher rates. But there's good news. There are treatments available. Cervical dilation can manually widen the cervix. In severe cases, minor surgery might help. Hormonal therapy can soften the cervix, and planned labor induction or C-sections can ensure a safer delivery. As Black women, it's crucial to advocate for our health. Find a culturally competent doctor who understands racial disparities. Get a second opinion if your concerns are dismissed. Keep medical records to track symptoms and test results. And always ask about alternatives if you're uncomfortable with a procedure. Cervical stenosis is real, and we need to talk about it. If this video helped you, please like, share, and subscribe to spread awareness. Have questions or experiences to share? Drop a comment. I'd love to chat. Thanks for watching, and take care.